This is Andy from All Points North. We're going IG Live. We have our beautiful nursing crew here, and we all know with the pandemic going on that our nursing staff, all over the world, all over the country, here in Colorado, and especially here at APN, are going above and beyond for us. So we're super excited to talk to these ladies a little bit and see, how they got into nursing and what our protocol here is at APN. And again, we just always want to express our gratitude to our frontline workers, and our nursing staff here has done a great job keeping the staff and our clients very safe and very protected. So first, I'm going to talk to Sunny about how she got into nursing and what that kind of looked like.
Yeah, so I got into nursing. I've been a nurse for about 11 years now. It was kind of a second career. The impetus for that was I had my son was a baby at the time, and he had to have a major kidney surgery, UPJ obstruction, and had a pyeloplasty at 4 months old. So he was tiny, and I just thought, it was just a good segue. I felt a calling. I felt that tug into nursing. I felt really supported by the nursing staff when we were in the ICU with him. And they were amazing, and I thought, I can do this, I can do that, and I love people, and I love helping, that cliche, but it's so true. And should I go into
anything you want? Yeah, absolutely.
So
she's a dookie. She's a dookie.
I am a dookie. You can see this, but I'm a buff. Went to University of Colorado nursing school at the Anschutz Medical Campus in Aurora, Colorado, and did have a job my senior year of nursing school at Duke. So moved the whole family to Durham. Started off as a solid tumor oncology general med surg nurse for a few years. Then went right into the toughest ICU, probably could be in the country, maybe one of a few, and dealt with lung transplants, heart transplant, VAD patients waiting for transplants, ECMO patients. So that means we have machines with patients that are breathing and pumping their heart for them. So it's been a ride at Duke, and then I've worked as a nurse clinician in the transplant center, worked with lung transplant patients, also did sarcoma research at Duke, so it's been a lot. But I am so excited to be here at APN. Behavioral health and addiction treatment and recovery is new to me, but I am loving every minute of it. It's amazing. So,
awesome.
Thank you.
Awesome.
Really.
Duke, that's a whole other conversation. We could talk about
Yes.
North Carolina and Tobacco Road, but we're not going to do that now. That'll save that. But we're going to go to Sandy and hear about how she became a nurse and her path as well. So go ahead, Sandy.
Well, nursing is actually my third career. I started out right out of college as a licensed clinical social worker. I got my master's degree and worked for probably 5 years as a home-based family therapist for Jefferson County in Colorado, with the families involved in dependency and neglect orders. And then, I became a mom, had my first child, and I was a stay-at-home mom for a couple of years, and I had kind of a complicated pregnancy and delivery, and it just sort of sparked my interest in the whole medical field. And also birthing. And so I, after having my second child, became a doula, which is non-medical labor support. And I did that as a private contractor for about 10 years. And in that 10-year process, I watched the labor and delivery nurses do what they do. They are an amazing group of people. And I decided that's what I wanted to do. So I went to nursing school. And I got my RN and worked in labor and delivery in Louisville, Colorado at Avista Hospital for 11 years. And then my husband and I moved up here to Eagle County, and I worked in the peri-op services unit at Vail Health for a year and a half. And then I came to All Points North Lodge, where I'm finally able to use my 2 Colorado state licenses in nursing and social work together. And my life experience has really brought me to this place, and I'm so excited to be here and help people with their addiction and recovery.
It's really awesome. You know, a lot of people in the substance abuse and mental health field, we get into this role to help people, and nursing can can mirror that too. But for Sandy and Sunny to have the want and the ability to help these clients in any way they can, it's just it's really cool to see, and we're lucky to have them. I'm going to go back to Sandy, I'm going to go back to Sunny about she has a little bit of a different role at times here, especially after COVID hopefully calms down soon. Hopefully you can elaborate on that for us. And
right.
let us know.
I initially was hired, I'm the director of quality and compliance and risk. But we certainly, with this pandemic, things have shifted in our organization, and being one of the only nurses in the organization, I needed to take care of our clients, our new clients that come in. And what we do is we test all of our new clients for COVID-19, and in the meantime, waiting on test results that come back from the lab. We are quarantining every patient for at least 7 days, or until we get a negative test result. What we're also doing here at All Points North, that has I think everything's been proven to be really successful so far. We're testing everyone's temperature before they go into the lodge and do their daily duties and do their daily jobs. They come by the nursing station, or they come by the front desk lobby, and we test temperatures. So we're looking for any temperature over 100.4. And I'm always asking folks if they have any symptoms, even if they're afebrile, if they feel good. Do you feel good? Do you have any symptoms? Because as we know, the virus can be really insidious, and some patients can not have any symptoms. So it is tricky, but we have done a great job. I think our staff is amazing. They're taking this really seriously.
Yep.
We have PPE available. Our executive team has been amazing with making sure that we do have enough gowns and masks and gloves and N95s. Thank you, Noah. Thank you, Dr. Modier. And we do tell everyone to please conserve all the PPE, and if they are not directly interfacing with clients, to reuse those N95s. So we have a system in place. And so far so good. It's just amazing. Eagle County was a little bit of a hot spot for a while. We're leveled off and plateaued with our cases. So we are so fortunate right now in this spot in time to be where we're at, to keep building our clientele and to be healthy. It's amazing.
I've been really impressed with how quickly we responded to the whole COVID situation, and how we all here work together as such a great team to keep everyone safe. All the employees, the clients, everyone. It's just an amazing place to be.
Yeah, I can definitely second that. Sandy and Sunny are they're two ladies, right? And there's 24 hours in a day, so they're working kind of crazy hours, and they're going above and beyond, and we definitely appreciate it. Our clients appreciate it. We do have some support staff that they work with, so we want to definitely shout out our support staff.
All the RAs are amazing.
We could not do our job without them and their support, and they are phenomenal people. It's
awesome.
Just incredible.
That's great. And the last shout out, or we would get yelled at, is one of our nurses that is not here right now. She's working over at an urgent care, kind of handling a lot of the COVID stuff for the county. Jana, we love you.
Oh, Jana, yay!
We wish you were here. And Chris and Dr. Modier, our whole medical team.
And Michelle.
Yes. I'm the idiot that forgets everybody. But again, we just wanted to quickly introduce our nursing staff and let everybody know how much care our clients are getting here. And again, we're just grateful to have the opportunity to be able to help people here at APN. So that being said, thank you, everybody.
Thank you.